Yes, now we'll discuss about the right atrium. This is right atrium here in this diagram, and in this diagram this is right atrium here. It has upper end, lower end. Upper end it communicates with superior vena cava, lower end inferior vena cava. Here is between right atrium and ventricle there is a groove, coronary sulcus, right atrioventricular groove. Here is on left side, this is appendage of the right atrium. This appendage is known as a right auricle. This is auricle, right auricle. This is appendage, right auricle. And on right side, vertically there is a groove. This is known as sulcus terminalis. This is sulcus terminalis. If you open this chamber by cutting the margin of this like this and open this chamber, now this chamber is open. This crack is here. Here is opposite this sulcus terminalis. In inner side there is a groove. Sorry, there is elevation. There is the ridge on inner side. Opposite to the sulcus terminalis, this ridge is known as crista terminalis. This ridge is known as crista terminalis. From crista terminalis, numerous musculi pectinati arise. These are musculi pectinati which arise from crista terminalis. Crista terminalis is a muscular ridge. This is muscular ridge. From this ridge, there are comb-like extension of the muscles. This is known as musculi pectinati. These are known as musculi pectinati. Pecten means comb. It looks like a comb. So known as musculi pectinati. Here are opening of the anterior cardiac vein. This is, there are 2 or 3 openings of the anterior cardiac vein. This is anterior cardiac vein. And sometimes here is another opening of the marginal vein. So this wall is anterior wall. You can see here the anterior wall is rough. Developmentally, it develops from primitive atrium. This is another wall. This wall from here to here, this wall is posterior wall. This wall is smooth. This develops from absorption of right horn of the sinus venosus. So this is smooth. And here you will find, here is interventricular tubercle. This is interventricular tubercle, and here is position of atrioventricular orifice. This is atrioventricular orifice. If you remove this wall, this is atrioventricular orifice. So this is interventricular ventricular, sorry, this is superior vena cava, inferior vena cava. It's lying between these two vena cava. Intervenicular tubercle. Action of this tubercle during intraembryonic life, it directs blood flow towards this right atrioventricular orifice. Another thing, this is crista terminalis. At the upper edge of the crista terminalis, there is a position of Yase node. This is position of Yase node, which is pacemaker of the heart. This is pacemaker of the heart. And another thing, here is another ridge. This is known as Eustachian wall. During embryonic life, it directs blood flow towards the here. Here is position of embryonic life. This is foramen ovale, through which the blood passes to this and goes into the left atrium. So, another thing, there are numerous small veins opened in this. These are known as vena cardi minimi. These are vena cardi minimi. So this is posterior wall. You have seen anterior wall. This is anterior wall. This is posterior wall. Now here is another wall. This wall is septal wall. This is septal wall here. From here to here, this is septal wall. This septal wall lies between right atrium and left atrium. Here is right atrium, this chamber. Opposite to this, there is left atrium. So it lies between the right and left atrium. This is septal wall. This wall is septal wall. At margin of the septal wall is formed by limbus fossa ovalis. This is margin which is formed by limbus. This is known as limbus fossa ovalis. This is formed by septum secundum, and this portion, this is a fossa. This is fossa ovalis. This is known as fossa ovalis. This fossa ovalis is formed by septum primum. So this is septum primum, and this margin is limbus fossa ovalis, that is formed by septum secundum. And another important thing, here is another opening. This is position of opening of the coronary sinus. This is opening of the coronary sinus. And another important thing, here is position of tendon of Todaro. This is tendon of Todaro. This is known as tendon of Todaro. This is tendon of Todaro. Here is tendon of Todaro. Between septal cusp of the atrioventricular groove, this is septal cusp, and this tendon of Todaro, and there is coronary sinus. There is triangular space here. This is known as triangle of Koch. Triangle of Koch. This is known as triangle of Koch. This triangle has AB bundle. AB node. Here is SA node. Here is AB node. This AB node is present in the triangle of the Koch, and the boundary of the triangle of the Koch is tendon of Todaro and coronary coronary sinus and septal wall of the tricuspid wall. So here is septal cusp of the right AB wall. So it lies here. So this is triangle of the Koch. And you can see in this diagram one important thing, that is opening in the right atrium. So here in the right atrium, superior vena cava, inferior vena cava, coronary sinus, anterior cardiac vein, and here are numerous veni cardi minimi are open and also communicate through AB orifice, atrioventricular orifice, to the right ventricle. So this is all about the right atrium. Thank you. Yes, now we'll discuss about the right ventricle. In previous lectures, you have seen here some named valve and tubercles. This is intervenous tubercle of lower. This is intervenous tubercle of lower. Here is Thevesian valve. This coronary sinus is opening of the coronary sinus is guarded by a valve known as Thevesian valve. So this is Thevesian valve. And here, this is inferior vena cava opening is guarded by Eustachian valve. This valve is known as Eustachian valve. So this is Eustachian valve. Now we'll discuss about the right ventricle. For discussing the right ventricle, initially cut this portion and remove from here. This is right atrioventricular orifice. It is guarded by valves. There are three valves. This is known as tricuspid valve. There are three valves. It has two parts. This chamber has two parts. One part is inflowing part. This is inflowing part. Blood passes through this and goes into the here. This is inflowing part, and this portion is outflowing part. From here, blood goes through the pulmonary trunk. So inflowing part and this is outflowing part. Inflowing part is rough. Here, rough. This part is rough. Roughness is due to trabeculae carni. This is a muscle known as trabeculae carni. This roughness is due to trabeculae carni, and this trabeculae carni, these muscles are arranged in three ways in form of a ridge, bridge, and pillars. These are fixed elevation in the wall. These are fixed elevations. These are ridge. Bridge connects the two walls like this. This is bridge. And that is pillar. Pillar has one end is attached with the wall and another end is free. This is pillar. This is pillar. So pillar has one end attached with the wall like this, and another end is free. This free end is connected with the cusp of the wall. So free end is connected with the cusp of the wall like this. These are also known as, pillars are also known as papillary muscles. These are also known as papillary muscles. So here the muscular arrangement are in form of ridge, bridge and pillar. These are fixed elevation, bridge connected two walls, and pillars, one end is fixed and upper end is free. Free ends connected with the cardi tendini. These are the cardi tendini. This is cardi tendini. through which it is connected with the cusp of the AB wall. So this is inflowing part, which is rough. Developmentally it develops from primitive ventricle, and here is a crest. This is known as supraventricular crest. This is supraventricular crest. Above this there is a smooth part, and here pulmonary valve is present, and this smooth part develops from bulbus cordis. It develops from bulbus cordis. So this rough part develops from primitive ventricle, and this smooth part develops from bulbus cordis. So another important thing, here is marginal band. This is marginal band is present, which is connected with this septal wall with the anterior papillary muscle. This is marginal band. So this is all about the right ventricle. Now we'll discuss about the left ventricle. This chamber is left ventricle here. This chamber is left ventricle. Here you can see this is atrioventricular orifice. This is, and this chamber here, it has also like right ventricle. There is inflowing part. So this is inflowing part. This is rough. The roughness is due to trabeculae carni, and here also these ridges are also here present. Ridges, bridges, and pillars. These pillars present in the wall like this, and from the papillary muscle through which the cusps are attached. Here this is known as mitral wall. Cusp of the mitral wall is attached, and this is known as cardi tendon. This is cardi tendon. This is rough part is due to this muscle, and developmentally it develops from primitive ventricle, and it passes deep to this right ventricle, and here it communicates with the descending aorta here. So from here to here, the rest part is smooth and which develops from the bulbus cordis. So this is all about the left ventricle. Thank you. Now we'll discuss about the left atrium. Here in this diagram you can see this is left atrium. There are 4 openings of the pulmonary veins which opens into the left atrium. It has a small extension known as this is left auricle. This left auricle is present here. This is left auricle. This is left auricle. This left auricle develops from the primitive atrium. That's why it is rough, and it has musculi pectinati, and the rest part develops from absorption of the pulmonary vein during embryonic life. That's why large area of the left atrium is smooth. There are 4 openings as you have seen, and if you open this chamber, then you will find there are small veins. These are the veni cordis minimi, like in the right atrium, veni cordis minimi. And here is interatrial septum. This septum lies between the right atrium and between the left atrium. Here is fossa ovalis. This is fossa ovalis. Fossa ovalis. If you see from the opening of the right atrium, if you see this from opening of the left atrium, at the site of fossa ovalis there is a bulging known as fossa lunata. If you see from that side, then there is a bulging that is known as fossa lunata. Opposite to this, there is fossa lunata. So here, this is fossa openis, and on left side, this is fossa lunata. So this is all about the chambers. There is atrioventricular orifice here. Small portion I am showing here. This part. This is left ventricular orifice, which is guarded by mitral valve. If you cut this valve, then you will find this. Here is mitral valve, your bicapsid valve. So this is opening through which left atrium opens into the left ventricle.